Hi, good morning, Vincent. My name is Shirley Rowe. I'm your invigilator for the OET speaking session on the 26th of March 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Vincent Frederick.
And what is your candidate number, please?
My candidate number is 240269002.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Describe your work style as a nurse.
I am very focused on my work and consequently, I am able to work quickly. Also, I keep a steady pace and check my work as I go along to prevent mistakes from snowballing. That's just because I am very organized, which makes me able to accomplish a lot in a limited amount of time. To summarize, I am organized and efficient, and I'm able to multitask very well.
How would you handle a patient who complains about everything?
I understand that some patients will complain about everything just because they are unhappy about what brought them to our care. So, first I will listen to them and collect all the details they wanted to share. Then, I would check on their concerns and validate their complaints. If any action is to be done, I will make the necessary arrangements and then reassure them that we were doing our very best for them. I will also do a follow-up later and reassure them that everything possible is being done to make them comfortable.
Are you a self-motivator as a nurse?
Absolutely. I strongly believe self-motivation is essential to accomplish the goals. I am very motivated to do a good job at what I take on, and I like to stay busy. I can always find something productive that needs doing. I am a self-motivator, and I take great pride in my job as a nurse.
Would you become a doctor if you had the opportunity as a nurse?
No, I enjoy the personal contact with my patients and the comradeship with my colleagues, which is unique to nursing. I chose to become a nurse because I find the field fascinating. I still hold my passion for nursing and enjoy my career as a nurse. I plan on advancing my career as a nurse, not a doctor.
What do you feel when you contribute to your patients as a practical nurse?
I offer my patients the very best care and advocacy I can. I believe that I offer my patients comfort and confidence that they are being well cared for. Most importantly, I reassure and make the patients feel that I am there to provide comfort and understanding, that I will listen to their concerns, and I will act as their advocate, if necessary.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good morning. My name is Vincent Frederick. I am one of the nurses working in this clinic. How may I address you?
Good morning, nurse. My name is Shirley Rowe, and you can call me Shirley.
Hello, Shirley. How may I help you today?
Nurse, I am here to get advice.
Sure, you may proceed.
Nurse, my son is recovering from chickenpox, and I want to know if it's safe for my pregnant niece to visit him.
Shirley, I appreciate your decision to seek medical advice on the scenario. First of all, let me inform you that chickenpox is contagious until the blisters have crusted over.
Okay.
Blisters that are dry and crusted are no longer able to spread chickenpox. So, do a check on it to find out the probability to spread.
All right.
Before proceeding further, I would like to know about your niece's current condition. Could you please brief me on it?
Actually, nurse, I don't know in much detail. But she's approximately 16 weeks pregnant.
It's all right. Well, do you know about your niece's previous exposure to chickenpox?
I don't really know if my niece has had chickenpox.
All right. Surely, pregnant women who haven't had chickenpox are under the high-risk group.
Oh, I see.
The uncertainty of the niece's chickenpox status makes it complicated to come to a safer conclusion to make her visit.
I understand that, nurse.
Surely, may I know whether you have informed your niece about your son's chickenpox?
No, I haven't told my niece about my son's chickenpox.
Okay. So, I advise you to inform your niece about your son's condition, and it is the easiest way to handle the situation.
Nurse, I really don't want to worry her, if I don't need to.
I understand your thoughts. If that's the case, I strongly suggest you delay the niece's visit.
However, nurse, I think it must be okay for my niece to come, because my son's had chickenpox for 10 days now.
Okay.
Nevertheless, all his blisters are dry, so he can't be contagious. Isn't it, nurse?
Your thoughts are sensible. However, I would like to outline the risks and the need to be cautious when dealing with chickenpox during pregnancy. Please be patient and listen to me.
Okay, nurse. I will. You may please continue.
Thank you, Shirley. Now, low birth weight and limb abnormalities are more common among babies born to women who are infected with chickenpox early in their pregnancy.
Okay.
There are some serious complications that pregnant women may encounter with chickenpox during the pregnancy. The chance of getting infected with pneumonia, hepatitis is very high.
Oh, I see.
And in return, it may lead to further complications. I hope you understand what I am saying?
Yes, nurse. I understand the need to be cautious.
That's good to hear.
Well, nurse, is there any treatment available if my niece did get exposed to chickenpox?
I am glad to hear this question from you. It shows your care and responsibility toward your niece's health condition. Yes, there are treatment options available. I will provide the information.
Thank you, nurse.
About the treatment, an injection containing antibodies is the most common treatment option available. However, your niece should consult the GP and get advice on it, as she is pregnant.
Okay, nurse.
Surely, I strongly recommend that your niece's visit should be delayed, and it is safer, and as you told earlier, you really don't want to worry her by knowing it.
Yes, nurse. I will definitely delay her visit for another week, until my son has completely recovered.
I appreciate your decision, Shirley. And I am glad to help you today in taking a responsible decision. Thank you for paying attention to me and valuing my suggestion. Feel free to contact me, and I wish your son a speedy recovery.
Thank you, nurse. That is the end of your OIT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.